Students these days and young are more comfortable talking to almost anyone about things that people in my generation would have saved for a therapist or a clergy or maybe a family member. So now RAs and professors and academic advisors are hearing stories that are concerning, worrying, and upsetting, and sometimes those include thoughts about suicide or self-harm, and often more often they're about anxiety, depression, and worrisome relationships. With the newer generations being raised with screens and screen time and social media, their time spent in actual human connection is decreasing, and they have more time interacting with sort of a black and white world of, likes and dislikes and what's good and what's not good. Connection makes people feel better. And one of the things I talk about is our helpline, the 24-hour line, that's really designed it's a catch-all for anything, from the very complicated to the very simple. What I tell them is there's no cost, right? The only thing they have to think about is, what's a good time for me to call? Many people will reflect and say, I don't know, this isn't that bad. I know there are worse people off than I am right now. I'm not sure this is worth the time of the counseling center or the therapist or whoever. It is. If you're having that thought, it's because there's something that's weighing on you, that's heavy for you. Whether that measures against somebody else's scale, it doesn't matter. If it's that way for you, that's what matters. I also talk to clients and students in general about mental health care. If they can start thinking about it more as dental health care, it gets a lot easier. When you have a dental problem, you're gonna see a dentist, and it's nice if you already know who it is. You already know who you're gonna see and go talk to because you met them before and they looked in your mouth. Kind of similar, and we can't always do everything for everybody, but if people start thinking about mental health care in the same way they think about getting your teeth checked and cleaned, we're gonna be at a better place.